Hello, my name is Dr. Irvin Sani with Spine Center of Texas, and if you're watching this video, you're probably about to have surgery. So I wanted to talk to you a little bit about what's important before having surgery. For one thing, depending on your overall health status, you may be asked to see your primary care doctor or an internal medicine doctor to have what's called medical risk stratification, which is also referred to as medical clearance. What this means is that we're going to send you to your doctor to have a basic checkup, and if there's anything that's worrisome, it will be investigated further to make sure there's no acute risks at the time of your surgery. This doesn't mean that we're trying to cure your hypertension. This doesn't mean that we're trying to cure your diabetes. This simply means that we're trying to make sure that there's not any obvious terrible thing that might happen under the anesthetic, say a massive heart attack or some other serious complication that occur that can be avoided by simply running a few tests. So when we ask you to go see your primary care doctor or an internist for pre-surgical clearance or risk stratification, this is very important. Although it's inconvenient and it delays the time to having your surgery, it can, in some cases, mean the difference between life and death. So before having surgery, it's important to take very good care of yourself. It's important to have good nutrition. It's important to get good sleep. I certainly wouldn't recommend that someone who's, say, overweight and they're getting ready to have back surgery or they're getting ready to have a knee surgery suddenly try to lose a whole lot of weight right before the surgery. But you certainly wouldn't hurt yourself by improving your nutrition. Eating fewer processed foods, trying to eat more green, living, whole vegetables, and so forth to provide your body with the nutrition that it really needs. Twinkies and Pop-Tarts and breakfast cereal don't really have a whole lot of nutrition. You aren't going to hurt yourself by converting over to more healthy, whole foods prior to your surgery. If you're a smoker, it would be great if you could either cut back or completely quit smoking, especially if you're having a spinal fusion surgery. No smoker wants to hear this, but it's just simply true. The nicotine, whether it's from smoking, from a patch, from gum, from tobacco, from snuff, doesn't matter what the source is, the nicotine causes vasoconstriction. It causes the arteries to squeeze down, and it restricts blood flow to the fusion site if you're having a fusion surgery. This can increase your likelihood of having a non-union or a pseudoarthrosis by 40%. And although we can sometimes curb this by using what's called an external bone stimulator, it is still much better if you at least dramatically reduce your nicotine intake prior to the surgery. Another thing that I've found to be very helpful is the use of Hibiclens. Hibiclens is a soap that will actually kill MRSA. MRSA is methicillin-resistant Staph aureus. This is a community-acquired bacteria that has become a real problem in recent years, primarily because of overuse or use of antibiotics. When you use Hibiclens, it doesn't guarantee that you won't get MRSA, but it certainly will reduce the chances of getting MRSA. The proper use of Hibiclens is at least the night before to rub the Hibiclens, not just where you're having your surgery, but all over your body, and allow it to sit for up to 15 minutes. And I recommend letting it sit for the full 15 minutes. You don't need to go any further than that. 5 to 15 minutes is the recommended time frame. Put it on like suntan lotion, let it dry. Don't wipe it on in the shower as the water's hitting you, as the Hibiclens will essentially do nothing. But if you rub it on for 15 minutes all over your body, let it set, and then wash it off in the shower, you will get many, many hours, in some studies over 12 hours of protection against MRSA. What I recommend to my patients specifically is to buy the medium or large size bottle of Hibiclens, which is generally around $10 to $20. It is an expensive soap, but it's very effective. And I ask that they bathe in the way that I've described for a number of days, even 5 days before the procedure. There's no study that proves that this is necessary, but I believe this really helps to keep the infection rate down. And after surgery, I then have the patient continue to bathe in Hibiclens in the way that I've described until their staples come out. With this, I've had a very, very low infection rate with many different procedures that I do where hardware is implanted. You're also going to be receiving antibiotics at the time of your surgery, but I believe the Hibiclens is really a great way to at least help reduce the chance of getting an infection. You'll be given a back brace to wear. This back brace is to provide you with comfort and support. Don't get stressed out if your back brace is actually hurting you worse immediately after surgery. I see this a lot. The reason is your wound is fresh, your staples are prominent, and we try to compress the abdominal and back area with the back brace, it can actually induce pain. Many people can wear a back brace immediately after surgery, but understand that with today's technology, you are stable. When I put hardware in your back, you are stable. So the back brace is not to keep your back from falling apart. Your back brace is for comfort. And if it's not providing comfort, if it's making you hurt worse, then simply don't wear it. Once the staples come out and the wound cools down, then you'll likely be able to put the back brace back on. If you're a patient who is unstable, I will make that clear to you, and you will understand how important it is to wear your back brace, whether it's comfortable or not. But this is more the exception than the rule. At the time your surgery is scheduled, you should be given a follow-up appointment. If you aren't given a follow-up appointment, then please call the office to get one. You also will be given a prescription just prior to your surgery for your pain medications. Typically, we will give you hydrocodone and a muscle relaxer to use in the immediate postoperative period. This will be called into your pharmacy either the day of or a couple of days before surgery so that you or your family member can go to pick this up and you don't have to worry about it after the surgery. A lot of people want to know how many days they're going to spend in the hospital after surgery. The reality is there isn't really a set number of days. It's really more goal-based. If you can attain those goals 5 minutes after surgery, which is impossible, then you could go home 5 minutes after surgery. So it's really not based on time. I do tend to give patients an average time of how many nights they can expect to spend in the hospital, but the goals are pretty simple. We want to get all the IVs out of your body, which means you have to be off of IV pain medication and not have a need for IV fluid. This means you have to be able to eat and at least pass gas. You don't have to have a bowel movement before you leave, but it is important to at least pass gas. You have to be able to walk as far as your kitchen and your bathroom at home, both for obvious reasons. Once all the wires are out, your Foley, which is the urine tube, is out, and we generally try to get that out on post-op day 1. Your pain is reasonably controlled with oral pain medications, and you're able to ambulate and transfer in an appropriate manner, you're good to go. You can go home at that point. Depending on your age and your needs, you may go home with the care of a relative, especially if they're competent to provide that care for you, or we may arrange for you to have a home health nurse visit your house and provide you with whatever services you need. This could be anywhere from bathing to transfers to cleaning your wound, examining your wound, physical therapy. In some cases, people need even a higher level of care, and they'll be sent to a rehabilitation unit where they will get one-on-one care as an inpatient, and then will be discharged home once they are able to transfer. In other words, if they couldn't meet the goals that I stated earlier, then they may need to go for inpatient rehab until they can meet those goals. It is important to get to your bathroom and your kitchen, obviously. And so once those goals are met, then you go home, and then even then after being in inpatient rehab, you might then undergo home health for some period of time until you're comfortable. The bottom line is we're not going to leave you stranded. We're going to make sure that you have the services and the care you need so that you will be able to recover from your surgery in an optimal way.